the fear of the word of someone actually making it a reality and saying, yes, you have cancer. Yes, you need this treatment, that treatment, the other, really terrifies people. The only way that I've found to sort of combat that, like I said, is just to continually have that conversation open and say, okay, we're going to just take it one thing at a time. I know it's overwhelming. I know it's a lot, but the alternative is not living. And I always try to be really gentle with my words with folks, but I also don't want to sugarcoat anything. Like, if you do nothing, I can almost guarantee you that you will die. And if you do something, at least we have a chance. And ultimately, that's their choice. And I always like to empower folks to make their own personal choice, but nothing is a guaranteed bad outcome. Part of the impetus for me going into breast cancer was not just my experience in my clinical duty, but while I was in medical school, my best friend's mom actually was diagnosed, and she had a really, really, really tough course. She actually had inflammatory breast cancer. And these was the first times that I was hearing some of these terms, inflammatory breast cancer, triple negative breast cancer, and it was so different from the impression that I'd had about breast cancer as a layperson. I saw walks and runs and people being 20-year survivors and overcoming it and, kind of made it look easy. But her experience was not like that at all. And it was very traumatic for my friend. It was very traumatic for her mother. And ultimately, she passed away from metastatic disease. And so that really changed my approach and my outlook on what breast cancer could be and what it looks like for different people. I start every appointment by asking patients what they understand to this point and how did they get here. Because many folks, we are a big tertiary care center, so many folks may have seen someone already or have at least heard something about their diagnosis. And I think asking that question empowers people to say, this is what I understand, but also this is what I don't get. And then I think that sets a good foundation for the appointment, and I hope that it also builds some rapport to let them know that, I'm not just going to be here kind of droning on to you about what I know, but I want you to be an active participant in your care as well. Yeah, you have to stay really vigilant. I think I probably annoy my patients sometimes and I have to give huge kudos to my nursing staff. They are wonderful. I reach out to them a lot and be like, hey, Miss So-and-so was supposed to come back. She didn't. Can we call her, see what's going on? I have called patients personally and said, hey, you were supposed to see so-and-so from medical oncology. This is really important. Is there a reason why you haven't made it? Is there something else that we can do? Is there something that's unclear we can clear up because it's really important? This is time sensitive, And I've had a couple of patients say, I'm afraid. And I'm like, okay, what can we do to help you be less afraid? I'm not saying that you're not gonna be scared. It's cancer treatment, it's a huge deal, but we can kind of take it step by step. And if there's something in particular that you're worried about or that you're afraid about, if you can tell me, then hopefully I can then again arm you with some information, some knowledge, so that you don't feel like you're walking into, an ambush. I don't know that I detach myself emotionally from it. Whether that's good or bad, I don't know. I don't ever really want to be completely emotionally detached, because if I'm emotionally detached, then I've lost my empathy. And I've lost my ability to relate to my patients and kind of meet them where they are, and I really don't ever want to lose that. I am optimistic. I'm impatient. I wish things moved faster. I wish they got better quicker. I wish there was more buy-in on a systemic level to help change some of these things, because yes, patients can lower their risk by, not drinking as much, not smoking, having a healthy diet, but we can't forget about the systemic things that impact people's ability to do those things. I think that's probably where our bigger impact is going to be, but that takes a lot of buy-in, that takes policy, that takes a lot of moving parts and a lot of people working in concert to make that happen. Who I think about it's a large part of my motivation for what I do every day, because I know that her experience is probably more common than we think, and we have to do better for those patients. And I hope that in whatever small differences I make, whether it's clinically or on the research side, that if fewer women have that same experience, then I will feel like I have, done what I came to do.